Good morning, good morning, good morning on this beautiful Monday evening. Yes, it's always good morning in Long Reach Science International, as that's how our chairman uh has taught us. He says good morning, no matter what time it is. It's just gone 7:05. So let's see if we can get leaders to come through today's training. Good morning, great leaders. Can we please share? Yeah, first things first, am I audible? I really hope so. I really hope I'm audible. Let's just have a look. I'm just checking now. My phone. Let's see. Science International. Okay, yo, I'm audible. Okay. I tried to find the most fitting, or should I say befitting place, as I am not home. I'm traveling the country this week. Let me just delete this. Good morning, great leaders. Thank you so much for availing yourselves. May we kindly share this training with our beloved teammates, your clients, maybe, as today we are talking about a very sensitive topic, which many do not actually know that it is sensitive. We are talking about a liver disorder called hepatitis. Good morning, good morning. Hey, Dida Muzi, welcome. So we've got our two gents. Let's please share this training. I will give it a few minutes. I'm also going to try and share. Okay. I'm also going to share. I'm sharing now. Let's give it. It's 19:07 now. So 19:08, 19:09, we will start with the training. This training will be done by 8 o'clock. All right. So it won't be more than an hour. So let's see. Team expansion. I'm sharing. All right. Okay, I see someone, looks like someone is sharing team expansion. So let me not duplicate. Okay. Welcome, leader Sia Togoza. You are connecting from Zim. Welcome, great leader. Thank you so much for availing yourself. Thank you very, very much. Thank you very much. Okay, I started. See you after. All right. So I'm just talking to my colleague who I'm traveling with. Thank you so much, Leader Muzi, for sharing. Kindly share, kindly share. We will start in a few seconds now. Okay. All right, she's tired. She says see you tomorrow. Okay. Yeah, Shin, we work hard. We work hard. We don't play. Thank you so much, great leaders, for availing yourselves. Let me just do this. Let me just do this. Kindly call everyone that you can think of. Welcome, Leader Bolanle. Welcome. Kindly share this training with everyone that you might. You see, I was not aware of my screen that it's like that. Okay, everyone, thank you so much for availing yourselves. Like I said, I have also availed myself from my main job. Yeah, like I said, this week we are traveling the country, next week as well, but next week I might not leave. I have too many things to do. So, great leaders, thank you so much. Like I said, my name is Pulani Mudimwen. On the screen is written Pulani Product Specialist. I hope the right. It doesn't sound like my background is noisy as I'm literally right next to the ocean and it's a high tide. Thank you so much, ladies and gents. I hope you have your diaries. I hope you have your pens. It's going to be a jam-packed session. And let me repeat myself as I did last week. We do have a Health Hub WhatsApp group. Please WhatsApp me if you want to be in that group. That is where I share all trainings that I have ever done, including today's training that I am going to share. I only share trainings in the Health Hub from now going forward. Okay. I want leaders who are interested in the Health Hub. All right. And I'm catering to you and your needs as well. All right. Welcome, Leader Vivian. Welcome. So great leaders, thank you so much. Without further ado, let us start training. We are speaking about hepatitis. We are speaking about hepatitis. And as we're speaking about hepatitis, you will realize the dangers if you've never heard of hepatitis before. You will hear about the dangers and so many other things. All right. I like it when it's full screen so that you can see what's happening. Okay, this is much better. Right, let's start. So, so what are we going to learn today? We're going to learn the definition of hepatitis. We will concentrate on the 5 different types. There are more with illustrations. Let me just see. Can you see the screen? Okay, my phone is a bit behind, so I need to get out and I need to check. Go back in again. Okay, no, the screen is perfect. Okay. So, great leaders, definition of hepatitis. This is the agenda of the day, the order of the day. We're going to learn about the 5 different types of this disorder, along with illustrations and signs and symptoms. You need to know what are the signs, what are the symptoms. These are our clients. Maybe you yourself are your own client. Who knows? Risk factors. We also need to know prevention, preventative measures. Then we're going to summarize, and then we round it off with recommended long reach products. Okay, and then I've got a nice special for you at the end on the long reach organic products. I'm going to delve in one of the supplements that are recommended by me, yours truly. All right, so what is hepatitis? It's basically an inflammation of the liver. Okay, it can be self-limiting or can progress to fibrosis, aka scarring of the liver. It can progress to cirrhosis or liver cancer. Hepatitis viruses, so number 1, it's a virus. They are the most common cause of hepatitis in the world. But other infections or toxic substances like alcohol abuse and certain drugs, so certain medications, and autoimmune diseases can also cause hepatitis. Are we together, great leaders? So there are 5 main hepatitis viruses, which scientists have actually are saying that, okay, let's concentrate on these 5. These are the ones that are problematic. So they are hepatitis A, B, C, D, and E. You also get G and H, but those ones are rare, okay? So we're only going to do 5 types. They're the greatest concern because of the burden of illness and death that they cause and the potential for outbreaks and epidemic spread. In particular, types B and C, so hepatitis B and hepatitis C, lead to chronic disease in hundreds of millions of people and together are the most common cause of liver cirrhosis and liver cancer. Welcome, Leader Carol. Welcome from Pretoria, Matazante. And then hepatitis A and E, they're typically caused by ingestion of contaminated food or water. So think about the outbreak that's been happening, Leader Carol, in Pretoria. Remember, there was outbreaks, and then in some parts of South Africa, there were outbreaks of cholera, of contaminated water. So think about this. Now I'm bringing it home. Ne? So hepatitis A and E, they are typically caused by ingestion of contaminated food or contaminated water. Hepatitis B, C, and D usually occur as a result of parenteral contact with infected body fluids, so direct contact. Common modes of transmission for these viruses include receipt of contaminated blood or blood products, invasive medical procedures using contaminated equipment, and for hepatitis B transmission from mother to child at birth, from family member to child, and also by sexual contact. Okay, acute infection. Oh, it's hot in here. I put this thing on too high. Acute infection may occur with limited or no symptoms, or may include symptoms such as jaundice, so that is yellowing of the skin or the eyes, dark urine, extreme fatigue, nausea, vomiting, and abdominal pain. So, this is your liver. I won't say the liver now. This is your liver. So, your liver can get one of these five. Sometimes it's all three at once. I know someone with hepatitis A, B, and C at the moment. Okay? So of an estimated 1.4 million deaths per year caused by hepatitis virus, 47% are attributable to hepatitis B, 48% to hepatitis C, and then 5% to hepatitis A and E. So concentration is hepatitis B and C, okay? Though you get all five prevalent, but do you see that hepatitis B and C are the ones that cause more problems? Are we together, great leaders? Are we together? Moving on. So the different types, scientists have identified 5 unique hepatitis viruses, right? We just named them now, A, B, C, D, and E. While all cause liver disease, they vary in important ways. So you need to know what differentiates them. Ne? So hepatitis A is present in feces or infected persons and is most often transmitted through consumption of contaminated water or food. Okay, thank you, great leaders. All right. Certain sex practices can also spread the HAV, hepatitis A virus. Not A, I don't say HIV, ne? I know some of you guys. HAV. Infections are in many cases mild, with most people making a full recovery and remaining immune from further HAV infections. However, HIV infections can also be severe and life-threatening. Most people in areas of the world with poor sanitation have been infected with this virus. Safe and effective vaccines are available to prevent HIV. So think about, welcome, Sawubona, Coach Nafti. So think about where there's sanitation problems anyway. It's not just in South Africa. Malawi also had a water outbreak, the cholera. You remember, it started last year. Okay, so then there is a diagram. Remember when we started, we said definition of hepatitis. This is the agenda of the day. We're going to learn the 5 different types of the hepatitis with illustrations, signs and symptoms, risk factors, prevention, summary, and then we delve into our awesome language products. All right, so we were here. So direct contact, food and beverages, poor sanitation. That's how it is spread. And then the symptoms include abdominal pain, vomiting, yellowing of skin and eyes. All right. Or reduced appetite, weakness and fatigue, joint pain. Ooh, hepatitis A is hectic, eh? Pain in the right side of the abdomen. The right side. I guess the liver is more towards the right side. Okay. Hepatitis B, that's the second one. I think we're going to concentrate on 5, even though there's 7, but we're concentrating on 5. So hepatitis B is transmitted through exposure to infective blood, semen, and other body fluids. It can be transmitted from infected mothers to infants at the time of birth, or from family member to infant early childhood. Transmission may also occur through transfusions of HBV contaminated blood and blood products, contaminated injections during medical procedures, and through injection drug use. HBV also poses a risk to healthcare, our beloved nurses, our doctors, our healthcare workers who sustain accidental needle stick injuries while caring for infected HBV patients. Safe and effective vaccines are available for this condition, luckily. So, again, how is it spread? Mother to child at birth, exposure to infected blood, sexual transmission, right? And other objects handled by infected person. So we need to be very careful. Do you see we've got many customers actually? Remember, hepatitis is a virus. So C, the third one, mostly transmitted through exposure to infective blood. So similar to B, this may happen through transfusions of HCV contaminated blood and blood products, contaminated injections during medical procedures, and. Okay, sexual transmission is also possible, but is much less common. There is absolutely no vaccine for HCV, so hepatitis C. There is no vaccine yet. So do you see where they differ? Why we need to know the different types. So if someone comes to you and says, hey, I've got hepatitis C, then you know, or you just refer to this training. Okay. Hepatitis D. Infections occur only in those who are infected with hepatitis B. Okay. We were at C, ne? D, yeah. Infections, for you to get hepatitis D, it depends on if you had hepatitis B. Are we together? The dual infection, so it's a dual infection. The dual infection of HDV and HBV can result in a more serious disease and worse outcome. Hepatitis B vaccines provide protection from HDV. Are we together, grade leaders? So you see D. If someone says to you that they have hepatitis D, then you know that they also have hepatitis B, dual infection. We need to know, understanding. We need to understand these things. Unfortunately, a lot of leaders don't want to understand these things. Go to the market, we meet people out there in the streets, they ask us difficult questions, and then left with a huge question mark on your face. We don't want that. That's why the Health Hub is here. And then hepatitis D is also known as Delta hepatitis, right? Remember this is all viruses, right, affecting the liver, right? So causes, again, the infection is contagious and spread through direct contact with bodily fluids of an infected person. Hepatitis D only occurs in people who have hepatitis B. We need to know these things. Okay, and then symptoms, yellowing of the skin, yellowing of the eyes, which is called jaundice, joint pain, abdominal pain, vomiting, loss of appetite, and dark urine. Moving on, hepatitis E. So A, B, C, D, E. So we are on the last one now, ne? I'm flying, eh? What's the time? Yeah, I'm flying. So this one, the first one, is mostly transmitted through consumption, contaminated water or food. Okay, I see my screen is busy blinking. I think the Wi-Fi here is a bit off, but I understand the weather. So windy outside. So hepatitis E is mostly transmitted through consumption of contaminated water or food. Do you see why cleanliness is next to godliness? You see why we need to sanitize, we need to wash our hands before we touch and touch and touch and touch and touch, way before we even get to COVID stories. So HEV, it's a common cause of hepatitis outbreaks in developing parts of the world, like Africa, and is increasingly recognized as an important cause of disease in developed countries. Safe and effective vaccines to prevent HIV infection have been developed but are not widely available. So this one, the vaccine, is readily available in China. All right. So hepatitis effects, let's summarize and then we'll do the master summarizing. So direct contact, so highly infectious. Direct contact, food and beverages, poor sanitation. Do you see why sanitation is actually a basic human right? Okay. Symptoms include abdominal pain, vomiting, yellowing of skin and eyes. Do you see all of them? It's abdominal pain, vomiting is standard. And then sometimes yellowing of the skin and eyes. Okay. So here, prevention. Look here. Prevention, hygienic food and water, clean bathrooms, proper hand washing, so proper sanitation. Okay, we cool, right? When we go back for hepatitis C, prevention, strict precautions to infected blood. Do you see why there's so many practices, adopted practices or standard practices that are done in the healthcare sector? There's so many things that they have to look at. Hepatitis B, prevention, hepatitis B, vaccination as soon as possible after birth. That's why our children are also given this. Okay. Hepatitis A, prevention, hygienic food and water, clean bathrooms, proper hand washing. So we're just going back to proper sanitation. Basically, that's the prevention. Proper sanitation. Okay. Are we happy, great leaders? So, all right. This is the master summary. All right, so hepatitis A, B, C, D, E. That's what we're discussing today, right? When we say viral genome, you can go and research this, okay? But if you have been attending the trainings, you should know what all of these are. RNA, I think everyone knows what's DNA, right? But RNA, not many people know it, and I'm not going to explain it. All right. So what we need to worry about is the transmission. So hepatitis A, fecal, oral route. So drinking water that has traces of feces, right? That's hepatitis A. Hepatitis B is blood and other body fluids transmission, right? Hepatitis C is transmitted how? Also through blood. Hepatitis D, blood and other body fluids, and hepatitis E, fecal oral route. So this table is here just to make things easier for you, okay? If all of that information I said, if you don't got time for that, because there are just people who just don't have time for that. Okay, and then incubation period, how long does it stay in your body? 14 to 28 days for A type. And then the B type, 30 to 180 days. You know how long is 180 days? 3, 6, 9, 12, 15, 8. So 6 months. 6 months hepatitis B. And hepatitis C is 14 days up to 6 months as well. Hepatitis D, HDV requires HBV for replication. Remember that with hepatitis D, that person needs to have hepatitis B as well. And then hepatitis E, the last one is 14 to 70 days. Diagnosis, sorry about that. Diagnosis, anti-HIV specific. Okay, that's hepatitis A, hepatitis B, HBV, surface protection. Listen to that. We're just talking about sanitation here now. We're talking about sanitation and the jabs. All right, but basically here. And then possible chronic infection. This is very important, leaders. Possible chronic infection with hepatitis A? No, there's no possibility if you do the right things. Okay, there's always a catch to these things. Reading between the lines. So possible chronic infection, not with hepatitis A, yes, with hepatitis B, C, and D, and E. Okay, possible chronic infection. The only one that's a no is the first one, hepatitis A. The rest, you can be chronic. So in other words, for the rest of your dear life. And then vaccines are available for A, hepatitis A, B, no vaccine for hepatitis C. Remember, I was even loud. No vaccine for hepatitis D. And then hepatitis E, like I said, is available in China. Are we learning? Remember, anyone can get this. Anyone. Anyone. You see how easy? You remember how easy it was for a person to get COVID? Just think about it like that. Okay. So again, hepatitis A until E. This is just another way of explaining this one, just with other added stuff. Okay, so hepatitis, you see there are vaccines. What vaccines are available for which types of hepatitis? Except for C. Remember, E is available in China. Okay. And remember, if I said, thank you, Coach Naftali. Remember, I said this will be shared. All training material is shared in the Health Hub WhatsApp group only. I don't share it with any other group since last week. I stopped doing that. All right. And then estimated cases worldwide. Hepatitis B and C alone account for 400 million cases. 400 million cases worldwide, hepatitis B and C. And then gradual death, an estimated 1.4 million people die worldwide from hepatitis every year. Every single year. Can be you or me. But we are long reaches, right? And then treatment is 90% of hepatitis C patients can be healed within 3 to 6 months. And then how does it spread? Hepatitis A and E, they're spread how? Lack of food hygiene. So I go back to cleanliness is next to godliness. Ne? So lack of food hygiene, contaminated water, and substandard sanitary facilities. So, hey, as ladies, it's a problem because we have to go to the toilet and sit down. So imagine you go to the toilet and sit down and you get hepatitis from that. Do you see how dangerous this is? Do you see how we don't realize the dangers of every day to day? You'll actually realize these dangers when you do hygiene and sanitation course, which is one of the courses that my other company offers accredited. See, you actually won't even want to eat. Let's put it that way. And then hepatitis B, they are spread through blood, through sperm, and other bodily fluids. All right. So, da, 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 recommended long reach products. See, this lesson should be short. I said we'll be done before 8. Recommended long reach products. Our classic style alkaline pie cup. I forgot to take the brown tea. It's there. I'm not gonna stand up. It's here on the picture. Classic style alkaline pie cup. Remember, it's antiviral. Remember, it's antiviral. It also has because of the anions. Let me say that. Okay, anions protect the body from diseases. I will just stick to anions. I don't want to be long. Our sea buckthorn berry oil. Okay, this poster I designed it last year, so I'm using the old berry oil. I forgot to update it. Okay, but there was no time. The berry oil. Our sea buckthorn berry oil soft gels. I don't know if it's me or if it's this thing. Why is this thing not now playing? Let me just check. I don't know. Leaders, can you hear me here? MTN is very bad here, but I hope you can hear me. Can you hear me, team? I don't know, my phone is stuck. Yeah, I see even here the Wi-Fi is low. Reload. Let's try again. Okay, I don't see. I'm struggling here. I'm struggling. Bolande, can you hear me, leadership? Because my phone is a problem here. There's low coverage of my MTN network here. Okay, well, thank you, Oscar. Okay, sure, thank God. All right. So it's just my phone acting. MTN, guys. Okay. So it's the alkaline pickup, it's the berry oil. It's our cordyceps military supplement and our brown tea. Brown tea is known as the liver tea. Remember that, right? Brown tea is known as the liver tea. All right. Please note, over 300 million people die per year from hepatitis, and 300 million are unaware. So 325 plus 300 is 625. So it affects over 600 million people, and half of them are not aware. So now we're gonna dive into our berry oil, a little bit more scientific stuff. I needed to do this so that you understand our potent products. Okay, so the sea buckthorn berry oil is the only one that I went deep in, just so that I don't like a PDF that's too long, unless you know about that specialist. But for training purposes, we just need to appreciate berry oil, and thank God we are getting it soon, right, in South Africa. I'm not sure about the other countries. So, main ingredients in berry oil: oxalic acid, most polyphenols. I will go here. Berry oil is used for what? For liver and kidney. Now, typical symptoms: fatty liver disease, alcohol liver. Remember, alcohol is also a risk factor for one developing a hepatitis disorder. Okay, cirrhosis of the liver, hyperplasia. Hey, go back. I don't know what I did. And deficiency of kidney. So right now, for the purpose of this training, I'm only going to be talking about the liver stuff, right? So our berry oil, it protects liver cell membranes. Okay, it has obvious inhibitory. Now I'm reading here on medical function. The medical function of our berry oil. It has obvious inhibitory effects to liver injury caused by ethanol, so alcohol, paracetamol, paracetamol serial third transaminase, so amino acids, and AST. So here now I was just being too scientific. I'm sorry. Okay, so these are AST is an enzyme that is manufactured in all organs of your body, but it's highly concentrated in your liver. It's mostly concentrated in your liver and your muscular tissue. Okay, and increased resistance of liver MDA content. It repairs damaged liver cells. It promotes the liver cell regeneration. Remember, the liver, by the way, the liver is the only organ that regrows. They can cut the liver. You know, there's so many people that went for a liver, what you call, liver operation. Maybe they had to cut. All right. And then it regrows. That's the power of the liver. It's the only organ in the human body that regrows. Okay, so if you know of anybody that has any liver, anything, any liver disorder, disease, you name it, please recommend our berry oil along with our brown tea. Okay, it repairs the renal blood vessels, so kidneys, right? blood vessels by the kidneys, and cells also protects the renal function. So here now we're just talking about kidneys. I said I'm going to concentrate on the liver. Okay, number one, here is a study, okay, in 132 cases of patients with acute viral hepatitis, acute, not chronic, né? 130 patients were cured. The other two patients, health turned into good condition. The efficiency rate was 100%. 130 cases of serial third transminase returns to normal, and the average recovery time of 14.8 days. We're still talking about the liver here. Né? All 98 patients with jaundice, backing down Huang rate up to 100% on average rate of 9.5 days to 23 days. And then 68 cases were turned into normal retraction of total 87 cases of liver tumor. 15 cases have obvious retraction and only 4 cases were changed a little. So there's a high efficacy rate of our berry oil when taken correctly, by the way. Nausea, vomit disappeared within 3 days, patient's appetite being promoted significantly. Remember, with hepatitis, nausea is one of the nausea and vomiting is one of the symptoms. You see why we need to know the symptoms as well. So if someone comes to you and says, hey, you know, I'm nauseous, and then you ask them, okay, how long has this been happening? Please jot this down. How long has this been happening? Have you gone to the doctor? Do you maybe have hepatitis? And then they say yes, then you can easily link. Okay. Otherwise, if it's a woman who says she's nauseous, maybe she's pregnant. I'm just saying, and she still needs berry oil, by the way. Okay. Moving on. So the main functions of berry oil, you can still see me, I hope, because this phone, my network is still bad. So main function, I will only talk about the liver one. Eh? The others you will read yourself. Okay. So the main functions of berry oil is to strengthen the immune system, right, and improve liver function. Very important, anti-inflammatory tissue regeneration. Remember, hepatitis is an inflammatory disorder. So, sea buckthorn berry oil, it has anti-inflammatory properties. All right, and then antioxidation effect, it removes free radicals. Those things are very important, guys. There are people with hepatitis can affect your eyes. And when I say eyes, I'm not just only talking about the yellowing of the eyes. Berry oil is very good for the eyes. See why we need to know about our products. And then see buckthorn berry oil versus the liver. Add lanzu. Hey, I'm not Chinese. I'm gonna try. Ne? Add lanzu, probably lanzu. Ne? Lanzhou Medical College, they came to the conclusion after a long-term research results that our berry oil has obvious improvement and protection on liver injury caused by carbon tetrachloride, paracetamol, and alcohol. These are studies. This is a medical college. Okay, so your customers for berry oil, people who abuse alcohol or people who drink alcohol, or if you drink alcohol, yes, when a long rich member, you need to be on brown tea, on berry oil. Okay. Remember, berry oil also helps with tissue regeneration. Thank you so much for your attendance, great leaders. Training is over. Are there any questions? Are there any questions? My phone is acting, so hey, me, I don't know. This phone is acting, but I'm happy that the Wi-Fi is working. I would have died and gone to heaven if it wasn't working. Are there any questions, great leaders? Are there any questions, teammates? We are approaching 14 minutes, 40. Oh, yeah, that's good. That's good. That's good. That's good. Are there any questions that you have regarding hepatitis? Sorry. So please, alkaline pickup should be your baby every day. If you don't have pickup, please make it your point. Make it a point that you get the alkaline pickup. Okay, please. Yes, leader Adijat, it is very good for ulcer. Berry oil is very good for ulcer, along with the alkaline pickup. Excellent for ulcers. Coach Naftali, I tell you when you are a very good student. Berry oil is very good for ulcers. Let me show you leader Adijat. Just backtrack. Here it is. Here it is. Anti-gastric ulcer in yellow. Here. Here. Anti-gastric ulcer. And don't take I'm presuming it's gastric ulcer, stomach ulcer. I always presume stomach ulcer. I'm sorry. I hope I'm right. Please don't take stomach ulcer light, eh? It can become stomach cancer. All right. So ulcers, I don't know why people take everything so light. Stomach ulcers are nothing to joke about or to not take seriously. Please. So what berry oil does, let me teach you something about berry oil. I don't think I've mentioned this, I'm not sure. So berry oil, what ulcers do, right? They eat away ulcers, remember they eat away your skin, right? The ulcers. They eat away your skin. Right? Thank you, Leader Uzoma. So what berry oil does, right? Remember, it's a natural antacid. So it comes, right? And thereon where it's damaged as well, it helps with DNA support and repair, and it helps with flesh development. That's why people heal fast. Even diabetic patients who have slow healing wounds. That's how they heal fast using our berry oil. So that's what berry oil does. You saw, ne? It helps the cells to regenerate. Okay, so it does that. It goes into the stomach. It has a soothing effect on your sores in the stomach, right? The peptic ulcer, the peptic, right? It soothes and then it rebuilds the skin. Otherwise, if it doesn't do that, that's why it's easy for people who have peptic ulcers, stomach ulcers, to develop stomach cancer. Okay. So, and cancer, where does it live? In an acidic body. What is an acid? It's an acid. An acid is an acid. So we drink, eat, breathe so much acid. That's why we need to balance the scales with our alkaline pickup, with our products, with our brown teas, green teas, with our teas. They balance. All right. They are alkaline. They balance our body. Okay. So please, please, please. Yeah, the weather is not friendly. Sure. The weather is really definitely not friendly. So great leaders, let me give it another minute. We are on 43 minutes. Okay, so at 45, we will end this. We will end this. We will end this. And then another announcement. Okay, the first announcement, I'm repeating. Remember, I said we have a WhatsApp group, a dedicated WhatsApp group. It's closed. Only myself and SD Vivian are admins. There's no good morning there. Hey? There, I just give you information. Okay? So this training is going to be shared in that group only. I don't email anymore. I don't. It's much quicker and faster for me. Okay, my schedule is too hectic for me to be sitting and watching, looking at emails every now and then. So we have a dedicated WhatsApp group. Please inbox me on WhatsApp or inbox me here on Facebook, saying that you want to join, or you can also inbox SDVerve to include you in the WhatsApp group of the Health Hub. Number one. Number two, leaders, you need to be healthy. Ne? I get it, this is the Health Hub. For those who do not know, we have a Longreach Fitness Institute. The Longreach Fitness Institute, we are taking new members from August. From the 1st of August until the end of August, we are taking new members. It's a free service only for Longreach members. And so is the Health Hub WhatsApp group. I don't take prospects in there, okay? Definitely not. It's only for members. It's a value-added service to you. All right. So if you want to be part of the Longreach Fitness Institute, doesn't matter your fitness level. If you I don't know, if you are unfit, you are more than welcome. The aim is to get leaders to exercise. Even if it means you just walk, it's fine. You don't have to be crazy like some of us. Okay, so because I know a lot of people, they love the camaraderie, they love teams, they love, people love that. A lot of people love that. So if you want to be encouraged and you want a support system, support structure for you to get your health back on track, please inbox me. Okay, inbox me. I'll put you in the group from August. We need leaders to be healthy. Your health is your wealth, literally. You cannot be earning so much money and then you're earning so much money, but then you can't even walk up just one flight of stairs, you're out of breath. Like you're going to leave your money there and go to the afterlife. So I'm encouraging. The reason why I did the Long Beach Fitness Institute, we lost a great leader, Cargo, who I was on his case for the last 3 years. That Cargo, come, let's exercise. Let's exercise. Cargo, let's exercise. Now we've lost him. Maybe if he was exercising, he would still be with us. I don't know. But exercising minimizes your risk factors. Okay, leader favor. My number is, I'm in South Africa, right? So you're going to do +27 if you're from outside of South Africa. So +27 735826733. So 073 582 6733. Oh, let me just write it here. Why am I being clever? 073 582 6733 is my WhatsApp line. It's my WhatsApp and call line. WhatsApp number. Okay, great leaders. We need to exercise. We're busy saying better life, better future, but okay. So please, I really implore everyone, many of you, to come. It's a free service, like I said. So why not? We do easy stuff. There's easy, there's intermediate, and then there's hectic stuff. So it's not all about, we just want leaders that gym. No, me, I'll be your number one cheerleader, I promise you. So thank you so much, ladies and gents. I see there aren't any questions. But yeah, next week, I'm not sure what we're talking about next week. But yeah, we will have training on Monday. And remember, I said as well, feel free to WhatsApp me your suggestions on what you want me to train on. Remember, this platform is for you as a Long Beach member. Okay, this platform is for you. It is made to make things easier for you to run your business. Okay, so many leaders don't know what our products do. That's why we have um what do you call it, the Health Hub. That's why I also have a YouTube channel. Okay, I've got a YouTube channel. So we are busy, guys. We are busy trying to make your life easier. Yes, I am a distributor, but I'm one person that I want everyone to win, basically. All right. That's why I'm training you here while I'm traveling the country with my other company. It would have been easier for me to say, no, I'm not going to train. I'm like literally on a private beach. Why must I? But I'm not like that. So thank you so much, great leaders. Please feel free to inbox me your topic suggestions that you would love for me to train on. It doesn't matter. You don't have to be from South Africa. As long as you are on Mother Earth, we are one team. Remember that. Thank you so much, great leaders. God bless. Adios.